Mike, I'm on. Yeah, Mike, you might want to supplement. So I think, Simon, that's a very good question, and it's a complex one. And if we look at all of the measures that South Africa and many countries have put in place, it is about being consistent and persistent in applying all of these measures. We do know in South Africa a lot of the outbreak began in some urban centers, and now the virus has moved into more rural areas, affecting different populations. We know that when a virus enters a country, it doesn't enter uniformly across the entire country. It tends to start somewhere and take root, and all of these measures do need to be applied in different aspects of it. I think what South Africa is doing, and they have very strong, a robust response. The leadership in taking a comprehensive approach, engaging communities, looking at a data-driven approach. We engage quite closely with South Africa through our regional office, through our international networks, to be able to apply what they are learning, to feed back into the response that they have themselves. And it is about continuing to apply all of these measures. They will bring this under control. As all countries will, in applying all of these measures, and stay vigilant, stay strong, continue to engage with communities, all levels of the community, listen to the community, feedback into your response, and adapt. Be agile and adapt. Mike?
Yes, and we are, I know Dr. Tedros has been in touch directly with very senior colleagues in South Africa, and we're working with our regional office on providing surge support, further high-level technical assistance to support South Africa in its response. I think we also need to remember that South Africa got its first cases quite early, and it's in a later stage of development of this pandemic. And the disease, when it came into South Africa first, tended to come into at the beginning into wealthier areas, and now has become very much established in poorer areas and townships and rural areas. So therefore, South Africa is experiencing that acceleration. But it's not accelerating any faster than many other countries in Eastern and Southern Africa, all over Africa. In fact, the South Africa numbers may be large, but they've only increased about 30% in the last week. But if you look around the region, in the same time, although the numbers are smaller, Kenya has increased 31%, Ethiopia 26%, Madagascar 50%, Zambia 57%, Eswatini 32%, Zimbabwe 51%, Namibia 69%, and Botswana 66%. And even though the numbers in those other countries are smaller, I think what we're starting to see is a continued acceleration of transmission in a number of countries in sub-Saharan Africa. And I think that has to be taken very, very seriously. South Africa may unfortunately be a precursor. It may be a warning for what will happen in the rest of Africa. So I think this isn't just a wake-up call for South Africa. This really is, we need to take what is happening in Africa very, very seriously. Many of those countries exist in the midst of fragility and conflict. Many of them need external help and support. But what they need is much more support to community-based interventions, and much more support to improving clinical pathways so people who are sick get adequate care. And as Sose has said previously, much more support to public health surveillance and being able to put in place the necessary early warning. So while South Africa is experiencing a very, very severe event, I think it is really a marker of what the continent could face if urgent action is not taken to provide further support. So I think, and we've seen this in other regions, sometimes this disease can take off very quickly, and sometimes in other situations it takes off more slowly and then accelerates, and it's difficult to understand fully why that is the case. But I'm very concerned right now that we're beginning to see an acceleration of disease in Africa, and we all need to take that very seriously and show solidarity and support to those countries who may now be experiencing increasing numbers of cases and deaths.
Thank you, Dr. Ryan. The next question, and it might have to be the last because we're coming toward the end of the time allotted, goes to Helen Branswell. Helen, can you unmute yourself and go ahead?
Hi, thanks very much for taking my question. I apologize, I missed the beginning of the briefing. So you may have covered this, but since Dr. Fowl is there, I would like to ask if he could give us any kind of a sense of how things are going on the ground in Ecuador province with the new Ebola outbreak. Numbers are available from the Ministry of Health in DRC, but we're not really getting much in the way of detail on how well or not well the containment effort is going. Thank you.